Just a quick anatomy lesson on what causes snoring and sleep apnea. The most important point on this model, which shows the tongue, the roof of the mouth, and the soft palate and the uvula, the little thing that hangs down the back of your throat, is this point right here. This is where all the air has to pass, whether you breathe through your nose or breathe through your mouth. We know from sleep studies done at various universities that two things happen when you fall asleep. Number one is this soft palate tends to collapse back against the throat, and the tongue, along with the jaw, tends to collapse back and close the airway off. And this is worse when you're on your back, and so many people have more snoring and sleep apnea on their back than they do their sides or their stomach. The oral appliances work by, this is a makeshift oral appliance, by holding the jaw just slightly forward and keeping it from falling back when you get on your back, side, or stomach. And it also stents open the back part of the throat so that you have an open airway to breathe all the time. The CPAP mask, which you may have tried at the sleep lab, whether it goes over your nose or whether it goes over your whole face, works by pumping a continuous column of air down through the airway space, and that keeps the airway space open. Unfortunately, less than 50% of the people are able to tolerate the CPAP for very long, and more the sleep docs are going to use an oral appliance for mild to moderate sleep apnea. The appliances are not new or experimental. They've been around in one form or another for maybe 50 years. But in the last 15 or 20 years, they've become more and more user-friendly. They're smaller, custom-made, and very comfortable for patients to wear. They're also fully adjustable, so that if we guess wrong as what position to put your jaw in, you can take a little wrench, which we'll give you at the time of delivery, and adjust it a little bit at a time over a period of a few weeks until you reach maximum treatment for your problem. At the end of that time, we'll send you home with a little home sleep testing monitor. Very simple, goes on your finger with a wristwatch around your arm, and this will show me the effectiveness of the oral appliance. We may ask you to advance it a little bit, or we may say you're doing great, keep it right where it is. Treatment of sleep apnea is real important and because we know it's linked to heart disease, diabetes, and other systemic problems. So don't leave your sleep apnea untreated. If you've had a sleep test, please give us a call and we'll be glad to work with you and your insurance companies any way we can. Thank you very much.